Bismillahirrahmanirrahim. Assalamualaikum and a very good day to all colleagues, friends and audiences who joining these recording sessions. My name is Dr. Shaiful Ehsan. I am family medicine specialist from UIAM Kuantan campus in Pahang. I would like to wish all of you happy World Family Doctor Day. So this is a recording video for me to share about publication, a book. So the book that I have published recently, the title is ECG Definitely Easy, that you can see on my background. So I would like to elaborate a little bit about this book, and I hope you guys can listen and also can enjoy listening to this video session. Okay, regarding my book publication, the title is ECG Definitely Easy, and this has been launched last year in September 2020. And you might ask me why I wrote the topic on ECG. Well, for me, job scope of family medicine specialist is multi-purpose, various, and covering all sorts of diseases. And when we were talking about non-communicable disease or NCDs in primary care level, either prevention or management, for me, ECG is one of the commonest assessment tool in managing such cases at primary care level. So it can be useful for screening and also can be useful when patient come with symptoms. We do ECG, especially when we newly diagnosed patient with NCDs, for example, newly diagnosed hypertension, diabetes, so we like to do the ECG screening. Some patient might come to us with symptoms, so we require ECG if it's related with cardiovascular symptoms. Electrocardiogram or ECG interpretation is a bread and butter for all medical doctors, regardless for any specialty and regardless where we are. This is because there will always be an emergency cases requiring ECG interpretation. So therefore, rather than pass the task to other colleagues, for me it's important for us, not only the senior doctors, the junior doctors also, and also the colleagues to understand the true situation, to correlate with the ECG findings and manage our patient while confidently. It's acceptable to reassure the findings by asking our friends or experts' opinions, but the initiation phase of the interpretation should be made by ourselves as the treating doctor at that point of time. Therefore, this book will cover the basic steps required in order to read and interpret common ECG findings. From the title, ECG is definitely easy. Each chapter will introduce a specific domain that is supposedly to be covered by each clinician in interpreting ECG systematically, rather than just focus on predominant findings only. And each chapter also provides scenarios for examples to the readers with inclusion of ECG figures. Therefore, for me, this book is suitable for all medical students, young doctors, postgraduate students, and any supportive medical staff who are motivated to learn about ECG. And this book is adequate to cover the common basic interpretations for common cases seen in the clinic or emergency setting. The principle of management related to the case scenario also has been included as part of revision for the readers and clinicians' preparation in their new work. It can be considered as the stimulus to read further in depth of each scenario that has been shared in this book. Initially, I had the idea and intention to write this book with the purpose to help the medical students and also junior colleagues to understand better in terms of ECG and how to read and interpret the ECG. This is because based on my observation, I found that they had difficulty in reading ECG during ward round and clinical work. And surprisingly, they have the misconception that ECG is. So we need to correct this misconception via education and also sharing the knowledge of ECG. You might ask me why I do electronic book, not in the form of physical book. Well, for me, by doing the writing in the form of electronic book, I can cut the cost and the budget, and therefore will let the students and the doctors or any colleagues buy the book in a cheaper price. And they can read the book at any time, because they just need to download it and reading the book using their smartphone. So they can bring their smartphone anywhere and they can refer to the book in the smartphone while doing their clinical. It's quite practical for the medical students and also for the junior colleagues to refer to the ebook via smartphone. And nevertheless, initially, I have the intention to give this book for free, especially in order to help students and also those colleagues from, and also those students from B40 group. But by using the online platform in order to sell the ebook, in order to spread the book to the multiple ebook bookstore, there are minimum prices need to be set as part of requirements so that it can be available in all registered or interested ebook stores. Therefore, the minimum price set is ringgit Malaysia 8 ringgit Malaysia, and that is the price for this book, which consists of 151 pages. Okay, now let me share you a bit about this ebook by using a PowerPoint. So through this PowerPoint slide presentation, I hope you can understand more about this ebook. So here I share my screen, PowerPoint presentation. So I hope you can see the slide on my ebook title, ECG is definitely easy. So this is the front page of the ebook with the title, ECG is definitely easy. And you can review or you can view this ebook by clicking and login into this website, www.n_man.aspx. You can also Google ECD Japanese Easy Dr. Shaiful Ehsan online, and you can see the website. So from this website, you can click to buy this book, and the amount of the price of this ebook is US $2, and it's equivalent to 8 ringgit Malaysia. And for me, 8 ringgit Malaysia is quite justifiable for the readers to buy because this book consists of the precise information and also some figures and some sharing cases that the readers can understand more about ECG. And this book, basically, I dedicate to my beloved mother, who always there supporting me and my career, and not to forget my wife, my family members, colleagues, and most of all is the students and also junior colleagues and also friends who all love me. So these are the chapter, a little bit of the chapter included in this ebook. So the first chapter discusses about the requirements before beginning reading ECG. So definitely, as we know that ECG is a tool, assessment tool. So the clinician should understand first the clinical history and also physical examination finding. So the first task is to verify the scenario, and after that can correlate with the ECG findings. So this chapter one is like the introduction part, whereby there are few steps or requirements needed before any clinician interpret the ECG. And the subsequent chapter is about the ECG themselves, about the basic principles of reading the ECG, and also the rate and rhythm, the cardiac axis, the intervals, and the specific waves of the ECG to be interpreted and also to understand. So these few topics is concise and really helpful for the readers to understand and to read ECG in a faster manner but systematic. So that is the just a summary of my ebook titled ECD is definitely easy. I hope and I wish the readers who have read or who are going to read this ebook will get the benefit and can improve their reading skills and interpreting skills of the ECG, and also can help managing their clinical cases much more confidently and efficiently. With that, I wish all the friends, colleagues, and also whoever joining these video sessions a happy World Family Doctor Day. And I think it's not need for me to wish all of you Selamat Hari Raya Aidilfitri, and do take care of yourself and your family and your friends. especially during this pandemic COVID-19. Stay safe and stay healthy. With that, I thank you. Assalamualaikum and a very good day.